Now, here's one question. So, I know that there's a lot of. Uh, I'm not even sure why it's. Maybe you can help me figure it out because I'm not kind of a dummy about these things, but I'm not sure why the how we count deaths is a big deal. And I mean, when I mean deaths, I mean deaths related to COVID. So I know I'm like when I was looking at the CDC site, I guess numbers from each state are absolutely different, especially from what media reports. So I mean, I know that death certificates take time to be completed. I also know that different states report at different rates, and I guess it takes extra time to code COVID deaths. Do you know anything? I mean, do you have any idea or like on why some of these, on why it's important to figure out how many we're getting from COVID, but also um, why is it important basically to real pinpoint? Um,
Right.
yeah,
Yeah. Boy, I don't, I'm not involved in the process,
yeah,
of determining a cause of death, and I don't know how a coroner goes about counting those.
yeah,
Um, I think certainly the majority of patients that we're aware of that die from COVID, there's not much question as to the fact that they're at least dying in part due to COVID. These are patients that were admitted to the hospital, have a diagnosis of COVID that's been verified, have a pneumonia or some process in their body that's occurring that is an effect of COVID. And yes,
yeah,
the patients a lot of times have, other comorbidities, diabetes, obesity, kidney failure. That's part of the process. But these patients are dying um, directly from COVID. Yeah, their body is failing from
yeah.
COVID. So how much some of those other things are,
A factor.
yeah, are a factor or exaggerated, I can't comment on that.
Yeah.
I think it's really part of the process, but
Yeah. But our deaths in the hospital that are from the COVID units, our coroner won't even open them up. They don't want to touch them. They just said, okay, it's COVID. So,
Oh, really?
yeah, they
Yeah.
don't. It's just
Actually, I've heard that.
they don't know what it's gonna. If it's is it gonna aerosolize? Is it gonna right?
yeah, yeah.
They're like, no.
What's the
What's the
benefit
point?
in
Yeah.
in doing autopsies on these 10 patients who are
Well, definitely died of
are
COVID.
are died?
What when they're pretty sure.
Right.
Yeah.
Yeah.
I
Yeah.
think I think that's the opening that why the famous podcasters like I'll just say his name finally, Joe Rogan. Why he'll I've always been trying to sidestep it, but yeah. So Joe Rogan and other podcasters where they have they're obviously he knows he doesn't have a medical degree, but his influence is just so huge. But it's openings like that where they'll say, "How come they don't do the autopsies?" Or they'll say, "Well, they didn't do autopsies, so they don't know." And and it's just because they don't know how impractical it might
Right.
be.
Yeah.
Mm.
And he's in his own bubble. I mean, $100 million guy, he doesn't understand that. Not that I do either, but I can understand that there's so many patients you can't take your time because you have a whole slew of other patients coming in.
Yeah.
Mhm.
Oh, yeah. I'm actually looking at CDC right now. It says certifiers are asked to use their best medical judgment when it comes to death certificates. So yeah, that's their out right there. So
I think the most annoying thing is when Joe Rogan and other folks will say they don't know what they're doing, and I'm like, oh my
yeah,
god,
I know.
how can you say that?
Yeah.
It's like
Like then who
nobody
does?
knew what COVID
Then who
was.
does?
Most people didn't even know what COVID was
Yeah.
before
Yeah.
March.
Yeah.
Let them put on PPE and come in and
Yeah.
prone some patients and spend some time watching people die, and they might understand the process a little better. But
Yeah,